popular saying that health is wealth has come to stay in our lives. Medical outreaches have been identified as one of the vehicles to realize this saying. One of such outreaches is the one organized by Fajim Medicare Foundation in collaboration with the Methodist Church Okioja Ijora, one of the suburbs in Lagos. Why Fajim Medicare Foundation?
Fajim Medical Foundation, it's a foundation that was conceived by Professor Fatima Abdul-Karim to provide succor for the less privileged and make medical care available to those in the community. Also to educate about common health diseases such as hypertension, diabetes, and the common cancers, and to educate on ways of preventing and detecting early.
Saturday, 31st August 2019, as early as 6 a.m., saw the gathering of children, adults, and the aged all seeking for free medical care.
People have been here as early as before 6. They even woke us up this morning.
In fact, the crowd is overwhelming. Some people came to the church as early as 6 o'clock this morning, just because they want to be part of this great program. And with my own calculation, I think that we recorded more than 200 people that are here this afternoon.
How was it preparing for this outreach?
Ijora is a semi-urban part of Lagos. It's not the hybrid side. Ijora is an area that history will tell us was very swamped in the past. A lot of people couldn't survive in the other high-income breed areas, cluster themselves in areas like this, especially Ijora. So this is a low to middle income earning area, and those are the people we target as the important ones in the society.
We didn't go far in advertising for this program. We just went to like 3 streets. We went for rally yesterday to announce to people that there will be free medical treatment here and free drugs.
And what does it intend to achieve?
Fajim Medical Foundation has took it upon itself to bring about medical outreaches which would help to alleviate minimal medical symptoms that everyday Nigerians go through.
How do you get to hear about this medical outreach?
Someone told me about it, then I came around.
It's only from our church, Christ Apostolic Gospel Church. They told us last week Sunday when we were doing service that there's a free health care here today, and all of us should come here.
I heard it from people around.
With the upsurge of crowd seeking for medical attention, what is the future of our medical needs in Nigeria, especially in Lagos State?
There's a gap in the medical system in Nigeria. At this point, we want to appreciate the efforts of Lagos State, because Lagos State government is trying its best to make healthcare, available to everybody, particularly now that they've introduced the health insurance scheme for Lagos State.
What impact will this kind of outreach have on the community?
A lot of people do not really know their status when it comes to HIV screening, and some of them, they don't even know their status with hepatitis. And the two diseases are very common in the society. So screening for them creates awareness, and then they get to know their status so that they can go for treatment before it's too late.
How has it been managing the crowd?
The screening process is orderly. We assign number to individual, so we take a roll. So once it reaches their turn, they come back to pick up to do the test, and then waiting for some minutes, they come back later to get their results.
How has it been being part of the medical outreach?
We start and plan these things thinking we are going to see 200 people, and then you see 500 people. It's been very satisfying, trust me. It's something that when the day ends, you look back and you tell yourself, I am glad I was able to help 200 people today that offered me nothing, and then they are happier, they are going back home feeling better than they came to meet you.
What do you have to say to the organizers?
They have did a lot in our life. They help our people, especially we unprivileged people.
Those people that organize it, may God help them. Very good program. And we people around here, we enjoy the...
May God help them.
A job well done. They have really tried because this will go a long way. I know most people don't have, they can't wake up in the morning and say I want to go to the hospital to do a checkup. So this is like an avenue for them to see a doctor, make your complaint, and then you treat you, then advise that subsequently you go to a hospital, maybe a general hospital, to go do follow-up or checkup.
They are doing a wonderful job, to organize an outreach like this, it doesn't come very easy like that in terms of cost. But they've been professional, putting together professionals who really know what they are doing, so that they can have a very successful outreach.
We really appreciate Fajim for this privilege too, because it was really well organized, and we ourselves are really fully prepared for it, because we have been longing to have such program. So we appreciate them for accepting our proposal and coming to our aid, to the aid of people in this environment.
I want to appreciate Fajim Medical Foundation for a good job well done, because they are the one that's sponsoring this wonderful health program.
What's next for Fajim Medicare Foundation?
The next level is the field. Today we've tried to deworm the children in the community. We'll be able to screen them for some common diseases, and the ones that we have picked up will be referred to secondary, institution for follow-up and treatment. And we'll be back in the community to do a follow-up to what we've seen now.
We wish Fajim Medicare Foundation success in their quest to bring Medicare to the doorsteps of every Nigerian.